Hi, it's Lacey from Fayetteville Pelvic Health and Wellness. I get a lot of questions from a lot of my clients actually about friends who are pregnant, and they're always asking me, when should my friend come? Should she wait until after she has the baby? Why should she come to see you? And I always tell them to try to send them. Encourage your pregnant friends to see a pelvic PT. I love when I have a pregnant patient who comes in prior to delivery because I get to teach them how to prepare their bodies for birth, and then I get to give them tools that they can use immediately postpartum when they certainly don't feel up to going to see a physical therapist and they're really just trying to worry about feeding the baby and getting some sleep. I can give tools, very basic movements to help encourage your body to heal, to encourage your core to work well, so that when you are up and moving more, when you want to return to whatever exercise you were doing prior to delivery, your core and your abdomen is more prepared. And so hopefully you will have less issues. I also encourage all postpartum moms to schedule an appointment with a pelvic health PT, certainly before you have any issues. So that's the time to do it, is when you are in the early postpartum months, even if you're not leaking, if you're not having issues with pooping, if sex feels okay, that's the time to go, because we can assess your body, we can get a baseline on your muscles and how everything is working, and we will prevent some of those issues down the road. Where a lot of women get into trouble is not understanding how their new body works, because our bodies are different. That's normal. So learning how to use those muscles and use them properly as you move forward will prevent some of those issues. So it's people like me who have had 3 babies. I've had a vaginal delivery, I've had a cesarean birth of twins, and I did nothing for myself after those because I didn't know. I was not practicing pelvic health PT. I had no idea how to rehab myself because I didn't really have any issues. But years later, trying to run marathons, trying to exercise regularly, I started having issues, leaking of urine, back pain, things that actually have caused me to stop running for a time in the past, because I didn't take care of it before, and years of compensation built up and caused me to have these issues. So that's why I love getting my hands on women before they deliver, because not only can we help answer a lot of the questions about childbirth, there's so many different things that we can talk about. We can also help with pain during pregnancy, but really what I think is most important is we can give women the education on how to help their bodies heal properly and how to avoid a lot of these very common issues postpartum. And postpartum is forever. So, these are things that many of our mothers and grandmothers are still dealing with because they didn't know that there was help for it. And our generation, I think, is more, because of social media, like, we're more aware of it. But I just encourage everyone to take that step. So if you have friends who are pregnant for the first time or the 4th time, encourage them to find a pelvic PT. If you're pregnant, find a pelvic PT. Find one before you deliver, and then schedule a follow-up after you deliver, whenever you feel ready for that follow-up, because there's so much education that we are not getting, and we as pelvic PTs, that's what we do. We are trained in all of that. We are specialized in pregnancy and postpartum. We have so much information to share. There's so much we can do. So that's why you should come see one. Certainly when you're pregnant, if you don't plan to get pregnant anymore, but you're postpartum, even if you're feeling good, it can be really helpful to have a check, just a whole top to bottom check by a specialist, because we are looking for things that are going to prevent you from peeing on yourself down the road, from having excruciating back pain when you're trying to run a marathon, all of these things that I didn't know. So that's why. And thank you guys for listening. As always, if you have any questions, you can post them below. You can find me on Facebook, Lacey Kells PT DPT, or on Instagram at Lacey Kells PT. And I can also help you find a pelvic PT in your area. So if you have questions and you're not in Fayetteville, I can send you the link to look and see who is practicing pelvic health in your area. So I hope this was helpful, and thank you guys so much for watching. I'll see you next time.